South Africa's private sector credit increased by 8.3% year-on-year in November 2022, below market forecasts. This data marks the 17th straight month of growth in private sector credit, but the softest pace since August. Meanwhile, expansion in the broadly defined M3 measure of money supply advanced by 8.76% in November, topping market forecasts and slowing from a 9.82% rise the previous month. A number of measles cases being detected across South Africa is rising daily. Since the beginning of October, the National Institute of Communicable Diseases has confirmed over 200 cases in 5 provinces. I'm now joined by Dr. Prudence Buthelezi, a general medical practitioner. Dr. Buthelezi, appreciate your time this afternoon. Now, talk to us about how measles is treated to start off with, and certainly some of the complications for those that catch it.
Good afternoon to the viewers of Newzroom, and good afternoon to you too. When we look at the measles, firstly, we need to know that it's a contagious disease. It's caused by the virus. So once it entered in your body or you are infected with it, it will take about 7 to 10 days before you can see the sign and the symptoms. So it's so important to know the sign and the symptoms, which will be your pink eyes, rhinorrhea or runny nose, sore throat, coughing, and sometimes some lymph node. And then the skin, there will be a rash on the skin. So once you see those signs and symptoms, you need to visit the doctor as soon as possible. Right now, as you've said it, that there is an outbreak in 5 provinces, which started in October in Limpopo and went to Gauteng, Mpumalanga, Northwest, and Free State. And they now, the National Institute of Diseases have realized that there is an outbreak in those provinces.
But how did this happen? Because most of us are immunized or vaccinated as toddlers or at a very young age. So was there a space where somehow there wasn't vaccination going on that resulted in this outbreak?
What has happened is that the World Health Organization have realized that during the pandemic of COVID-19, about 20 million of children, they've missed their first dose of vaccine. As we know that the vaccination is the one that can prevent the outbreaks or the measles infection itself. So during the COVID-19, many children, 20 million of children, they've missed their first vaccine doses. And as I can indicate that the dose, you will need to get it between the ages of 12 to 15 months. That's the first dose. Then the second dose, we get it when we are between the ages of 4 to 6 years. So once we have missed it there, the chances of outbreak, they are very, very high.
Now, Dr. Buthelezi, one of the things that I've picked up is that individuals as old as being in their mid-40s have been catching measles. How is this possible? Because the assumption is that they would have been vaccinated as young children. If they weren't vaccinated, what are the implications of catching measles as a grown man or woman?
It is highly possible that you can get infected with the measles if you are sitting around anyone who's infected, especially if you are not vaccinated. So many people, they don't know whether they are vaccinated or not. That's why it's recommended even when you are visiting, because now it's December time, people, they are traveling, they are crossing the countries. So it's possible that when you are going to a country that has is common with measles, it's important that you get a vaccine again. So that's why we are saying right now, everyone needs to get a vaccine of measles so that you can prevent it. Yes, you can get it. Right now, it's common between the children who are 2 months to people who are at 40 years. But mainly those who are currently being seen is the ages between 5 to 9 years. So it doesn't mean that as long as you are old, you won't get it. There are people that are 40, 45 years that we have seen that they are infected. And it's highly, highly possible that they never received the vaccine when they were young.
So what are the complications that you're likely to get if you get measles now as a grown person?
The most complication that you can see is when you are starting to have diarrhea and vomiting. After all the signs and symptoms that I've mentioned, once you start to vomit and vomiting and diarrhea, because it will cause to dehydration, and dehydration will result in you that you need to be hospitalized. That's a complication already. And sometimes the other complication, it will be bronchitis, pneumonia, which pneumonia is very, very fatal, especially to the young children. And sometimes it's the swelling of the brain, which is, we call it encephalitis. So those are the main common complications that you can have when you have measles and you are not treating it.
Now, we know that the National Institute for Communicable Diseases has declared this, confirmed it rather, that there is an outbreak. So what steps are they taking to deal or to counter this outbreak and to stop it from spreading to other provinces? We certainly read in the intro that in the 1 week there were 100 cases over a number of days, and then the following week those cases doubled.
What is important right now, because we are busy traveling to provinces, all those who have signs and symptoms, make sure that you visit the doctor, and after you visited the doctor and you are diagnosed that you have measles, isolate. And when you are sitting around the people, make sure that when you sneeze or you cough, you close yourself, or you close your mouth, and because it's contagious. So the droplets, once you sneeze and it goes to the air, and people who are sitting next to you, they will contract the infection. So it's important that you isolate yourself until you are fine, because it will take, when we say you are contagious, that means you are still infectious in that stage. At least 8 days once you are diagnosed with this. Within 8 days, you need to be isolated. Don't be around people. And another thing, once you are diagnosed with it, make sure, because there's no specific treatment of measles, but we treat the symptoms. If it's pneumonia, we'll give antibiotics. If it's rhinorrhea and so on, we'll give the medication for fever and so on. So there's no specific treatment. But once you see all the signs and symptoms, don't sit at home. Just go to the doctor and be diagnosed. Once you are well diagnosed, isolate. Make sure that you rest, you get enough rest, and you drink lots of water.
Now, finally, before we let you go, we talked about a number of 20 million. It's actually 40 million that missed the vaccine during the pandemic, and I'd like to imagine that number is across the continent or across the globe. How long do you think it'll take to contain, well, certainly the outbreak, or to deal with the fact that these 20 or 40 million people missed that window period when they should have been vaccinated?
It's so good that media like Newzroom has already started to talk about this. The more people they get information that they need to go to visit the doctors or the clinics or the hospitals and get the vaccine. So if your child has missed the vaccine, doesn't mean that you now have to stay at home. Take the child and take back to the clinic. They will vaccinate them, because if you are old and you know that you've never got a vaccine in your life, it's still a right time to go and get the what we call MMR, which is the measles, mumps, rubella vaccine. They combine them. So if you are old, you can get it you can get it this week, then you can stay 4 weeks before you get the second dose. So what is right is that you go and get your vaccines. We can still eradicate it, and we can still be able to stop the spreading of measles.
Dr. Prudence Buthelezi, General Medical Practitioner, appreciate your time this afternoon and bring us up to speed on that measles outbreak that has impacted 5 provinces across the country. And as soon as you feel that you have some of those symptoms, which include rash, runny nose, you need to see a medical practitioner.